Dr. Chan, we saw how quickly, right, with hockey, how it could go into schools, community transmission, et cetera. How should families and schools and youth programs, how should they all be, kind of approaching this as we get deeper into the winter months? And how do you kind of balance being open while also taking precautions?
Yeah, so I think there's responsibility on the part of the individual and the families. And there's also responsibility on the part of the businesses and the organizations, right? There's guidance out there that we have created for hockey, for other sports, for schools, for all different types of businesses, and we want people to continue to review that and adhere to that guidance because that is still in play. That is still the guidance that is going to help us prevent and control COVID-19 from spreading. At an individual level, I think each person, each family needs to make decisions on their own tolerance of risk and whether, for example, playing in a sport is acceptable. But at the end of the day, we know that this virus spreads very easily when there are groups of people in close contact to one another, and so there are some activities that are inherently more risky. And so we continue to stress the fact that people need to adhere to social distancing, need to try and avoid those group settings to the extent possible, be wearing face masks. Hopefully the businesses and the organizations are adhering to the guidance to help build in processes to do that, whether it's sports or schools or businesses. And then there's testing. We have made testing widely available. And so if people are having any symptoms of COVID-19, we do ask that they go and get tested for early and rapid identification of COVID-19.